else who's going to be speaking now. Her name is Cihac. She's a community organizer at Citizens Action and Western New York organizer for Healthcare for America Now.
Thank you. Thank you, Avery, for organizing this, and all the Organizing for America volunteers and those that worked on the Obama campaign. I was a little bit involved in the Obama campaign, and now I'm at Citizen Action as a community organizer, and Healthcare for America Now is my primary work. And so I want to tell you a little bit about where we are right now in healthcare reform and what Healthcare for America Now believes. You know, what happened during the Clinton administration was, I think that the grassroots Americans that wanted healthcare reform were taken by surprise by the huge amount of money and the Harry and Louise ads that the health insurance industry threw at those that wanted real reform. But this time, we're ready for them. Healthcare for America Now was started about a year and a half ago, purposefully to start the mobilization of the grassroots to push back on the huge amount of money that the private health insurance industry is going to throw at this issue. And so that's why we are so happy to be here with Organizing for America. We took 2 busloads of people to Washington, D.C. on Thursday. There's a lot of people here that were there. We met with Congressman Higgins and others. It was great. 25,000 people attended that rally to make sure that we have quality, affordable health care for all. The biggest part, Congressman Higgins just mentioned it, the most important part of any health care reform is the public option. So I want to tell you what a public option means by telling you what a public option is not. A public option is not socialized medicine. In Canada and Great Britain, they own the hospitals and they employ the doctors. That's not going to happen here in America. We're going to have a uniquely American system that is going to be affordable and accessible to everyone. So that's what a public option is not. A public option is not going to be free. Individuals, businesses, and the government will all pay, but it will be affordable for individuals, for businesses. We're going to bring down costs. A public option is going to be a not-for-profit system, a true not-for-profit system. There's 3 health insurance companies in Western New York. All of them claim to be a not-for-profit, but they're working on a for-profit model. A not-for-profit government health insurance agency will be able to invest in primary preventative care and wellness programs, and that's part of the legislation the Ways and Means Committee has drafted. Those are important elements to make sure people in the communities of color, people in low-income areas have quality access to affordable health care. What a public option is not going to do is limit your choice of doctors and hospitals. You're going to get a choice. You know, the private health insurance companies right now limit your choice of doctors and hospitals. There's provider networks. There's places you can go to get your health insurance and places you can't. The public health insurance option will allow you to choose your doctor and your hospital. And it's an option. If you have private health insurance and you're happy with it, you can stay with that. We're not going to take that away from you. So don't listen to the scare tactics that the Republicans and the private health insurance industry are driving right now. Listen to the facts of what's happening. A public health insurance option will create competition to bring down prices in the market. It's not going to drive the private health insurance industry out of business, as they would like to tell you. And New York is a great example of that. We have some great public health insurance options here in New York, and the private health insurance industry is doing just fine. So when people come to you and say, oh, I can't support a public option, it's going to be socialized medicine, they're not going to let me choose my doctor, I'm going to have to wait 2 years, tell them those are lies that the Republican Party is trying to tell you, and give them some facts. And you can go to www.healthcareforamericanow.org and find out more if you want to know more. We took busloads of people to D.C. on Thursday, 2 busloads from Western New York. We had to add a second bus. So many people are interested in this issue. And it was a crazy trip, 27 and a half hours round trip. We're all a little tired. But that's how important this is. So here's what's happening right now. In the House, they have come out, the 3 committees have come out with what is probably basically going to be one bill, the Ways and Means Committee that Brian Higgins sits on. And we want to thank him for taking such a leadership role in this, because that bill is a great bill. That bill gives a great public option. It makes it affordable for Americans. It makes sure that we have disparities and inequities are erased. It's going to give us great coverage. That's the bill we want. That's going to go into the House. Nancy Pelosi has committed that that's going to be voted on by July 31st. Our fight is in the Senate. There's 2 committees in the Senate. The Health, Education, Labor, and Pensions Committee that's headed up by Kennedy, but Chris Dodd is taking over for him right now as he's sick. And in that committee right now, the bill doesn't have a public option in it, but they're going to create an amendment that's going to add a public option into that. And Chris Dodd has committed to that, and we need to make sure that there is an amendment to that bill that has a public option. But our biggest fight is in the Senate Finance Committee. Now, our own Senator Chuck Schumer is a part of the Senate Finance Committee, and he is the one member of that committee that's committed to a public option. Senator Max Baucus, who chairs the committee, gets more money from the health insurance industry, the private health insurance industry, and the pharmaceutical industry than any other member of Congress. It's a problem. But we standing here today with our votes and our voices can counter the money that he is getting by contacting our members of Congress and saying you have to stand for a strong public option, by coming out to events like this, by canvassing with Connie and her group tomorrow, by staying in touch on what's happening. Some people are wearing stickers today that say text HELP to 94553 and you will get updates on your cell phone by the minute on what's happening on this healthcare today, and it will tell you what to do. These are the things we can do to make a change. We can make a difference and make sure the Senate's bill contains a strong public option. So text your number to that. Go to Healthcare for America now. Do something. You can make the difference in this fight.